Okay, this is Mike, and he lives in Kansas City, and he has a really interesting story. Mike, where do you work?
I work at a Christian school in Kansas City.
Okay, now why are you uninsured?
I'm uninsured because the employer that I work with doesn't have health insurance.
Okay, and the employer is
It's a non-profit organization, and there is no health insurance offered to the employees.
it's a Christian school.
It is a Christian school.
Okay, now Mike, are you an American citizen?
No, I'm a Canadian and British citizen.
Okay, and how long have you been in the United States?
I have lived here a little over 5 years now.
And you told me that when you knew you were coming to the United States, you got a lot of health care performed.
Well, not a lot. I made sure I went to see my dentist. I was seeing a dentist regularly, and I made sure I had that looked after. I was paying into the national health system in England, and the good thing is that if you had something that you were concerned about, you'd go and see a doctor about it, and you wouldn't be thinking, well, I hope I can afford this, or whether it's going to be something that's going to be, causing me financial problems. We paid into a system. We knew that I could go and schedule myself in for help. One of the problems, though, is that they have private health care in England, which you could see a specialist, and if you were prepared to wait 6 months to a year for a condition, then it was free. But if you were prepared to pay for it, then you could see the same specialist the same day virtually. And so you're in a queue, and the person who actually gets to get help usually is the one who's able to pay for the health care. So that's on the bad side. On the good side, though, you could even have no job, and you could be entitled to go in and have all kinds of surgery and various things done.
So when you lose your job in the UK, you don't lose your health insurance?
You do not lose health insurance, no. In fact, unfortunately, in some cases, being unemployed can sometimes have more benefits for you to, you get free milk, free travel, free all kinds of different things. Healthcare is free, your medication is free, you do not pay for anything.
So when you see a free clinic like this in the United States, which happens to be the richest country on the planet, what goes through your mind?
Well, I suppose my concern would be that there are millions of people who don't have health care. And that's pretty scary, because when something major happens, people face bankruptcy because they're forced into paying for huge operations. And so I would say, it's pretty scary when you have nothing at all to fall back on. So if you're healthy, then you can kind of squeak through. But I think also, I've done it. You get on the internet, you try and self-diagnose a lot of things and try and figure out what's going wrong, what are the conditions, what are the symptoms. Paying over the counter for medication is very expensive. So sometimes I think people would be on the side of not getting the help. I know I've had a few things I wish I had done with my teeth that are now becoming more of a problem, and so because of the cost of getting it looked at, I did not have it. Do you want to keep your house, pay your bills, or go and see a dentist? And the cost of that then puts you in a difficult place.
And then my last question, Mike, is what would you tell the United States Senate? What message would you give them? They're debating whether or not the American people will be entitled to health care. What would be the message you give them?
Well, I think people just need to really buy into a system. If there's something that's available for health care, I think looking at England, it has its problems, but I think it's a good system. I think people need to be able to see a doctor when they're ill and not have finances be the concern that people have, that they don't go and get help that they need.
Great. Okay, thank you, Mike, and my apologies for our broken healthcare system in the United States.
That's okay.